We have two options for an assisted vaginal delivery with either a vacuum system or forceps. And really, the concept with those two things is that you're trying to get this baby to rotate to get the smallest diameter to come through the pelvis while the patient is pushing. And then you provide traction with either forceps or with a vacuum to be able to assist in that rotation and pull while they push.
So forceps look like salad tongs. I will put a picture of what forceps look like, but they basically look like very fancy, very expensive, I'm sure, salad tongs.
Yes, absolutely.
Yeah.
And there are a lot of different shapes and sizes of forceps because depending on what your patient is presenting to you with, you want different sizes. And so there are some that are smaller for smaller infants. There's also some that are a little bit more elongated for those heads that have had a lot of molding. For an unmolded head that kind of came down quickly but still needing some assistance, we would have one that's a little bit more rounded. So the obstetrician, midwife, and or family practice doc, that if they're trained to know how to do this, and again, midwives are typically trained in vacuum over forceps, but you would know which one that you would prefer. There's actually also forceps for a breech delivery if in fact you are trained to do breech delivery with something called Piper forceps. And they're shaped differently because the baby's coming out in a totally different direction. And so those little salad tongs that you described have to go on the head in a different way in a safe method. There's a huge misnomer that forceps have kind of gone out of practice because they're so much more difficult to learn. And I really couldn't think that that's farther from the truth. You have to know how to use them both well.
And the way we're talking, we're like, every delivery gets a vacuum or forceps. But I want to remind you guys, you said at the beginning, this is about 5% of deliveries, but it's enough that it's awesome to know about so that you're not caught off guard when your doctor's like, hey, what do you think about forceps? I think a lot of people learn about forceps or vacuums and they're like, well, those sound really barbaric. But I want you guys to realize that the reason we have these is to prevent a C-section. Most people that come into labor and delivery want to do a large variety of things to try and prevent a C-section, including the staff, because we ultimately feel that either a vacuum or a forceps, when used appropriately by trained staff, is less risky than having a C-section. Okay, so fun fact, Hilary had a forceps delivery on my first baby. So my first baby was born in 2000.
Okay.
And I knew what forceps were because I went to nursing school and I had done labor and delivery as a capstone. Didn't work labor and delivery though at that point in time. I was with the old people. Literally thought, I mean, when you're kind of like sugarcoating it, like we just apply a little pressure. I thought he was going to hurl me across the room. It was a point in time where my baby's heart rate was down. I could tell that we were having decels. I knew what decels were. And he, old guy, by the way, I think he also delivered me. So not a young fella, came in, and it was one of those situations where they couldn't get the heart rate to come up. He said, this is to avoid a C-section, and just like pulled the heck out of that baby. And side note, you can still feel a forcep mark on his head, but he's graduated college. He has a degree in computer science. At the time I was kind of like, well, this could be a problem, and totally functioning human being. I believe he did go through the risks and the benefits, although I literally have no idea because it was very quickly, and he had him out. He was one of those doctors who was super trained in forceps and had him out very quickly. So that's what happened with Hilary. But I do want to talk a little bit about what are some of the risks with forceps.
The forceps needs to go, like you just said, those little salad tongs that goes around the baby's head. So if I were a forceps, I'm showing sort of where my hands are coming around the baby's head to sort of sit right on here and be able to get the baby to come through. So that inadvertently widens the diameter of what is having to come through the pelvis, because I now not only have the baby's head, but I also have those blades, and those blades are thin, but they still widen the diameter of what's coming through. And so you have maternal risks with the forceps that can cause vaginal lacerations, or what we call sulcus tears. You can also have a tear on the posterior side, like right where we think of where we have an episiotomy. It can tear, and that tear then can go into near your rectum. That's called a 4th degree tear. That can have longer term sequelae or long-term side effects. And you could still have a 4th degree having a regular without assisted vaginal delivery, having a vacuum assisted vaginal delivery, but your risk with forceps is higher because it's increasing the diameter. When you put a vacuum on a baby, you can see that this is not increasing the diameter of what's coming out of the vagina. And so this device does not widen that. So you don't have what I consider those maternal risks. And I just say that my maternal risk with forceps is more sulcus, vaginal up into the urethra and then posterior or rectal tears, those 4th-degree tears. You still can have risks to the baby with forceps and vacuum, and that is a skull fracture or tearing or shearing of the blood vessels that are in those, like in between the scalp and the skull, and that's called a cephalohematoma or a subgaleal hemorrhage. Those vessel tears that cause that bleeding, those can be more significant. The cephalohematoma, it's underneath the skin in a way that it can stop because of the suture lines of the baby. And a subgaleal hemorrhage is something that you can have more bleeding because it can kind of extend over the scalp. And so those are risks with either one, but the fetal risks are slightly more with a vacuum. And I counsel people that. Can people have a cephalohematoma or a subgaleal hemorrhage without assisted vaginal delivery? The answer is yes. It's just not as frequent. So if you look across the United States, the subgaleal hemorrhage risk for vacuum-assisted vaginal delivery is about 4.2, 4.3%. So there is some risk with that.
Yes. And before, when you mentioned the blades of the forceps, that's just a fun word we use for the salad tongs. There's nothing
Absolutely.
sharp on the forceps. It's all rounded.
Yeah.
Nobody could get cut by the actual forceps blade. We just use fun words at the hospital.
Absolutely. Thank you for clarifying. There's nothing sharp going in your vagina. It's this nice, rounded, smooth salad tong, as she described it. And that's really what it looks like. It's a big salad tong.